Joining in the program now once again is Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates. Dr. Taweel, good to see you again.
How are you doing today?
Doing all right. How are you, doctor?
I'm getting there. It's been a long year, so
yes,
I think we're finally slowing down a bit.
Yeah, it's been a long year. It's been a long couple of days these last couple of hours, so we're chugging along, however. So parts of Europe are struggling with a new variant with COVID-19, the BA.2 variant of COVID. There's been some reported cases in Michigan. What do you know so far about this variant, and is there any information about it that people should be keeping a close eye on? Any differences or similarities to Omicron or to Delta or other variants before that?
So the BA.2 variant, from what I understand, is a newer variant that's basically a step up from the Omicron variant. It's got a couple of things. You know, every time you have a new variant, you want to ask yourself a few questions. Is it going to be as dangerous as the previous variant? Is it going to be more transmissible? Is it going to be, are we going to be protected if we've had our vaccines? And the answer to those are still kind of in the mix. We're still kind of learning a lot about this variant, but so far what we know is that, yes, it is easily transmissible, however, not as dangerous. In other words, people that do experience the BA.2 variant are going to have a little bit more of a milder disease. It's going to be a lot like Omicron, where people were having just, mild symptoms. Even people that were vaccinated, we're also finding that people that have been vaccinated have been really well covered in terms of having a much more milder disease. So we're not having these flurry of hospitalizations that we were having. However, it is more transmissible. So while it is more transmissible, that means there's a larger population that's being exposed, a larger population is getting sick. So there's still going to be a little bit of a spike in hospitalization, just nowhere near the fraction of people getting hospitalized as we were seeing previously.
We're joined by Dr. Jamie Taweel, the internal medicine specialist over at Grand River Medical Associates, joining us on the MegaCast. Dr. Taweel, despite the necessity of primary care providers, there are too few of them, and trends are suggesting there'll be even fewer as current practitioners age and medical students with loans are going to more lucrative specialties than being a primary care provider. As a primary care physician yourself, can you talk about the shortage, how it affects how it affects communities, how it affects primary care providers too, that there does seem to be a reduction of the total number because of these factors that are at play in the medical community?
Yeah, I could talk about this for about 3 weeks. I have a lot. So there's always going to be a shortage of primary care because primary care is the person you want to see. And it can affect a lot of things. I mean, in Michigan specifically, we're in the Metro Detroit area. So we do have a lot of primary care physicians that are going to basically be available. But in upper northern parts of Michigan, or a little bit more less dense populated areas of Michigan, there's going to be fewer primary care, and that's going to continue to get worse as time goes on. Yes, people that are in med school are always going to chase. There's a fraction of people that want to take the more difficult to get residencies that are going to be, and I don't want to say that like that, but they're going to be residencies that are going to be a little bit more lucrative. So that tends to always be the big, with just the amount of student loans that people come out of med school with, it's no surprise that they're going to go for specialties that are going to just basically pay more. Primary care tends to be a little bit lower on that end. Now, it's not terrible by any means. We're doing fine, but at the same time, why choose a career if you have options to go better? But also lifestyle and things play into effect. It affects a lot of things. It really impacts the ability for patients to get good care. Primary care is just that, primary. We're the first people you see. So if there's a shortage of primary care physicians, what are you going to do? There's going to be a lot more people going to urgent care. And when you go to urgent cares, you're not really getting standard of care. What I mean by that, when I say that, is you're not having a lot of follow-up. I have patients that have been patients of mine for years. I know them extensively. I know a lot of the issues that they deal with. I know how all their issues, interact with one another. I'm able to basically treat them a little bit more completely, so to speak. I talk to all of the specialists that they're involved with. I read I'm coordinating care among different physicians and doing a lot of things to that effect. It's kind of difficult to do if you're in urgent care or an emergency room. And that's what people tend to start doing if they don't have primary care available, or worse yet, they don't even see a primary care physician. They're not getting their standard, age-appropriate screening for risk things such as colonoscopy, screening for heart disease, all of that. And that can lead to bigger problems down the road. And, studies have shown that people that go to primary care physicians with routine regularity tend to do better, less money in healthcare. They tend to be less ill in the long run. They're treated more appropriately, and they're catching things that could have otherwise been a bit more dangerous down the road. How it also impacts, I told you I had a lot to say, how it also impacts us as physicians, there's just a lot more people to be seen, which can be very difficult. You now have waiting rooms that are full of patients, wait times get longer, doctors are getting overwhelmed, the volume starts to go up, and it can become very difficult to start to give people very distinct one-on-one care when you have a waiting room full of people that are anxious to be seen. So it's not good all around, and hopefully that can be turned around.
So Dr. Taweel, why did you become a primary care physician? And then beyond that too, what can be done in the medical community among primary care physicians and those in medical schools that are consulting with these future medical professionals to convince people or attract people is probably a better terminology to use to being a primary care physician?
That's a big question to answer.
Yes.
So why did I go into primary care? I went into primary care for a multitude of reasons. My sister actually married a physician when I was 11. She's a lot older than I am. She married a primary care physician, and I was always enamored by him and felt that I loved the way he handled business. I loved the way people always kind of flocked to him at family gatherings and asked him questions. And he's always kind of been a hero of mine. So I definitely like that. But more importantly, I also just like the interaction that I have with patients. I have patients that I've seen for years that are super close to me that I consider family. And that's the aspect of medicine that I like. I like the relationships that I build with patients. Other people aren't so into that. And I understand that. Certainly, they just want to deal with the medical complexity. Surgeons want to deal with issues that are dealing with surgery. Not to say they don't love their patients and don't build amazing relationships. They absolutely do. It's just a little bit more complex, and it's a little bit more to their liking, and they like doing procedures. Our cardiologists they have amazing relationships with their patients, but they like to narrow it down to one specific issue, which is the heart, and then they go from there. It's tough to try and encourage people to go into primary care specifically because that may not be what people want to do. My vision of a family doctor growing up, when I said I wanted to be a doctor as a kid, I always just envisioned the doctor that I saw, which was my primary care physician, and then my sister married my brother-in-law, and it goes from there. Other people, they're more interested in more complex, and when I say complex, I mean procedure-based type of medicine that's a little bit more, I don't know how to put, just more, rewarding for people that like to do those types of things. If you were trying to encourage people to go into primary care medicine, I think it's going to be tough. There's primary care physicians, we do a lot of the paperwork of medicine. We do a lot of filling out forms, disability stuff. We do a lot of the, family medical leave paperwork. We do a lot of insurance paperwork, handicap plates. It just goes on. So that can be a major turnoff to people that are interested in medicine because they just want to do medicine. I often joke that sometimes I feel like I practice more law than I do medicine. As a primary care physician, sometimes I feel like I'm the therapist. I talk to patients about very personal things, and some people just aren't into that aspect of medicine, and that's okay. But if you want to make things a little bit more better for people to go into medicine, I think to reduce the burden of paperwork that they deal with, as well as give them more incentives. Increases in pay certainly would always be a benefit, as well as potentially offering them better student debt forgiveness, because student debt becomes a big major factor into what they're deciding. It can often be the case. So that's a very small answer that needs to be this big. So
We're joined by Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, joining us on the Michigan MegaCast. Dr. Taweel, another minute with you before we'll say goodbye today. At this time, anything else that would be important for Michiganders to be considering in their own personal health and in their relationship with their primary care provider at this time before we let you go today?
Yes, go see them. I joke with my patients. When do I have to come in? And I always say, look, I'd like to at least see you as often as a dentist. What I want to see at least twice a year, if you're healthy. If you have other problems, I want to see you more often. COVID is starting to get a little bit less on the forefront. So I would encourage people to definitely try to see their physicians a little bit more, catch up on all the stuff that they've been missing. An ounce of prevention is definitely worth a pound of cure. So I want to make sure that people are getting to see their doctors so that they can catch problems before they become big ones. And we're catching up to that backlog. And the guys that are in primary care love to be primary care docs, and they enjoy their patients tremendously. We do want to see you. So I encourage people to do that. And that's about it.
Dr. Taweel, thank you so much for joining us.
Oh, thanks for having me as always. I appreciate it.